Welcome back. It's 14 minutes to 8 o'clock. Where you live determines whether you get life-saving emergency medical care. The World Health Organization is concerned about poor infrastructure and the shortage of trained surgeons in many areas. In South Africa, for example, 1 out of every 4 seriously injured people are not transported by ambulance. David Stanton from Netcare 911 is joining us now to discuss this further. He'll be one of the speakers on this issue at the Africa Health Conference that starts tomorrow. Mr. Stanton, good morning. Thank you very much for coming through.
Good morning. Thank you.
An overriding question first. How bad is the situation in terms of people being able to access the help they need, for example, for surgery?
So we live in this very interesting setting where, depending on where you live, depends on what access you have. You can be in a part of South Africa where you get first world care, first world treatment is available, or you can be in parts of South Africa where you can be hours away from any sort of basic help. So it's this really big dichotomy of access based on geography more than anything else.
Yeah, and away from geography, costs implications as well?
So yes, there's always going to be the cost, private healthcare versus government healthcare. Government healthcare can provide as good a service as private can if you're in the right area. As soon as you head out into the rural areas, you just can't get it.
I was just about to say, when you say right area, I'm thinking you've got urban, peri-urban, and then you've got rural areas. They are battling. Absolutely.
There's vast areas of the Eastern Cape, for example, where it takes you 6 hours to get to help. And then it may not even be the best help that's available elsewhere in the country.
Yeah. So besides access and cost, what other challenges will people who are far off from those areas that are well serviced be facing?
The emergency services may be severely limited in those areas. Access to the patient could be really difficult. We've got a bit of a shortage of paramedics in South Africa, so especially at the advanced life support side, so they may not even be able to get advanced care when the ambulance gets to them.
Yeah, and then there will also be shortages of medication, I guess, medicines and drugs and stuff like that?
That's not usually a shortage that we face with in South Africa. We're usually fairly well equipped when they do get there.
Even in rural areas?
It depends on the level of service that's available, but most of the services that are running are reasonably good.
Yeah, I read in the press release ahead of this conference that's starting tomorrow that they said as part of all of these shortages and challenges that people actually die unnecessarily from treatable conditions due to lack of ambulance services and other infrastructure.
Sure. So trauma should be considered to be a treatable cause. Accidents and stabbings and those things are treatable because it's bleeding, and if you get to somebody quick enough and treat them properly, you should be able to stop bleeding, or get them to a hospital where the surgeon can stop bleeding. But if there's restrictions on that, that is going to have an impact on life.
And pregnancy? In those kind of areas?
Sure. That's been one of the biggest drives over the last few years of the healthcare system, both private and state, is to look after mother and child types of conditions, and it's something where we've made a massive amount of progress in this country.
Yeah. So what are you going to be telling the conference tomorrow? What will be your key message?
My specific topic is around when we're transporting critically ill patients, how to do it so that they have the best possible outcome. We have a limitation in the training in paramedics across the whole of Africa, and there's certain basic things that they can do to sort of improve the chance of survival. And that's going to be the key focus from my particular talk.
So are you focusing on that because there's a lack of proper paramedic training?
So we have a lack of numbers, so we have a shortage of advanced paramedics in the country. So whatever staff are able to get to those patients need to optimize it as best as possible. And as soon as we talk the rest of Africa, because this is the Africa Health Conference that we're talking about.
What's driving the shortage? What's behind this shortage?
Training is probably the biggest limitation. The training opportunities, and then we have a severe shortage drainage into some of the particularly Middle Eastern countries for more money.
Yeah, I know we tend to do this and people think, there goes another arrogant South African to look at us as maybe having better equipment, better infrastructure compared to the rest of the continent. But how do we fare? I'm asking this in a very humble way.
Yes.
How does South Africa compare with the rest of the continent when it comes to this topic? Because this conference is addressing a continental issue.
Absolutely. So South Africa is light years ahead of the majority of the continent when it comes to moving critical trauma patients. We have systems. There's probably about half the continent where there is no emergency medical services at all.
And I guess where there's war
countries.
and conflict, it'll be worse.
Absolutely. Then there's no services. All those services are completely collapsed.
So there's lessons we've got that we can impart to the rest of our fellow Africans to say this is how you could start by improving, like, for example, train people properly.
Absolutely. And we want to share the things that don't cost a lot of money. We want to share the simple things, the simple, quick interventions that can have the biggest impact.
Yeah. Now, that will be tomorrow. And I see that the whole thing, these efforts are really centered around the World Health Organization's World Health Assembly, where it spoke about, in 2015, about strengthening emergency and essential surgical care and anesthesia in Africa. But there are many African countries, for example, I don't know how we're doing here, where there's a shortage even of anesthetists.
Absolutely. So what they're doing, and the encouragement has been to establish sort of surgical centres of excellence, or bigger surgical centres, and then the challenge is getting the right patients to the right places. Not every patient needs a big fancy surgical centre. Some patients just need the basics.
Yeah, it's a 2-day conference.
The trauma conference is 2 days. Africa Health is running for 3 days.
Okay, the trauma one is for 2 days. What do you hope to get out of it?
You always meet interesting people from across the continent, and you're able to make form some networks, share some information, do some learning from basic settings, because in basic settings they do the basics better.
Yeah, because learning is a two-way. Eh?
Absolutely.
We've got some
Absolutely.
lessons to share, and then they can also share with you guys.
That's it.
Okay, thank you.